Malls, gyms, markets to be shut is what the Delhi Chief Minister said. Aishwarya is getting us more details on that story. We'll just go straight across to Aishwarya. Aishwarya, this is an important announcement from the Delhi Chief Minister, and that really stands out that there is a sense of panic in Delhi now that there is a shortage of beds. The Chief Minister says there is no shortage. We have 5,000 beds even now, isn't it?
Well, definitely, Chief Minister Arvind Kejriwal there trying to pacify the people. He began his press conference when he said that there is absolutely no shortage of beds. However, he did say there are certain people who are choosy, who are picky, and they want to go to certain hospitals, and that is something which is not possible at the moment. He, in fact, went out and said that the national capital has 5,000 beds. So trying to tell the people of the national capital, do not panic. But he also said that the need of the hour is for this weekend lockdown to be imposed. Otherwise, we will see the cases rise exponentially. Sneha, in the past 24 hours, the national capital saw 17,000 cases, which itself is a huge number. The number of deaths is also rising. Keeping all these things in mind, now Arvind Kejriwal is going ahead and putting the weekend lockdown. This is a weekend lockdown which has been put in place. Few things here and there have been exempted, but largely the idea is to make sure people do not step out because the numbers are rising. Sneha.
Yes, you know, but Aishwarya, malls and gyms, spas, auditoriums are closed. No eating at restaurants, only home deliveries. This in some way is going to impact a lot of people when it comes to the question of livelihood. And there is a concern that we have time to prepare in Delhi as well as other places across the country. Why do we need a lockdown right now? Though the government has in fact gone on record to say that lockdowns do not really help in flattening the curve, isn't it? It's only a stopgap sort of an arrangement if we see that the healthcare system, the infrastructure is not ready.
Well, Sneha, if we talk about data, let me tell you, close to 40% restaurants across the country have permanently shut shop. The other 30% are now working at just 20 to 30% of their capacities. Those two, according to the data which we have, those two will be shut down. So definitely it is a big blow, especially when we talk about the hospitality industry. But apart from that, when you listen to the chief ministers, they say the only option they have is to go for this. We have seen what Maharashtra has done. We are now seeing the national capital also following suit. They believe the only idea is to impose a lockdown because they believe people, especially on weekends, are not wearing masks. There are huge gatherings and people are not following the norms which they should be following. Otherwise, we would not see such a huge spike. And in the national capital from Friday till Monday, this is what Chief Minister Arvind Kejriwal is also trying to do. Make sure people do not step out. Make sure social gatherings do not take place. Sneha.
Absolutely, an urgent measure that the Delhi Chief Minister just had to take. Remember, Delhi is reporting the maximum number of COVID cases in the country. It's the city which is the worst hit, is the national capital. Aishwarya, be with us. We'll just listen in once again to what the Chief Minister had to say just a few minutes ago.
स्थिति जैसे हम देख रहे हैं, रोज़ केसेस बढ़ते जा रहे हैं, रोज़ केसेस बढ़ते जा रहे हैं. इस स्थिति को कंट्रोल करने के लिए दिल्ली सरकार ने कुछ निर्णय लिए हैं. आज एलजी साहब के साथ मीटिंग हुई थी और सब ने मिलके ये निर्णय लिए हैं कि वीकेंड के ऊपर कर्फ्यू दिल्ली के अंदर लगाया जाएगा. इसका कारण ये है कि लगभग हफ्ते के दौरान, वर्किंग डेज़ के दौरान आदमी को अपनी कमाई करने के लिए जाना होता है, आदमी को अपने काम पे जाना होता है. लेकिन वीकेंड में अक्सर जो लोग निकलते हैं वो अपने एंटरटेनमेंट के लिए या दूसरी एक्टिविटीज़ के लिए निकलते हैं जो कि कर्टेल की जा सकती है, जो कि जिसके ऊपर अंकुश लगाया जा सकता है. उससे बहुत ज़्यादा लोगों को दिक्कत नहीं होनी चाहिए. इसीलिए चेन तोड़ने के लिए वीकेंड के ऊपर, ताकि लोग ज़्यादा संपर्क में ना आए, वीकेंड के ऊपर कर्फ्यू लगाया जा रहा है.
All right, curfew during the weekend is what the Delhi Chief Minister has just announced. This is an important announcement given the fact that the situation in Delhi is in fact going out of hand. Though the Delhi Chief Minister said that 5,000 beds are there in the national capital. There is no reason to panic. Aishwarya continues to be with us. Aishwarya, the situation vis-a-vis hospitalizations, vis-a-vis medical attention, vis-a-vis getting the test done and getting the reports on time, it is rather grim and rather worrisome. It does appear that things unfortunately are falling apart right now, isn't it?
Well, Sneha, things definitely are falling apart. In fact, I'm standing right in front of a vaccination center here in the national capital, and people are not going out and getting themselves vaccinated. This is wearing a very deserted look. So definitely, what a lot of experts have also been talking about is the fact that people have not been going out. We did see vaccine hesitancy in large numbers, because of which people did not go out and get themselves vaccinated. Apart from that, now what we are seeing is a crumbling of the infrastructure. There is a shortage of bed, though Arvind Kejriwal in his press conference said there is no shortage. We are seeing oxygen supply also in certain states of the country in short supply. And apart from that, the number of deaths are also rising exponentially. In the past 24 hours, the number of deaths crossed the 1,000 mark. So definitely, all the data is pointing towards a crumbling infrastructure. Governments, they are saying that they are doing their level best. The central government too saying that they are keeping a very close eye on the situation in the country. Sneha.
Yes, Aishwarya, a lot of people ask this question, what next after the weekend curfew that has now been imposed in Delhi? Is there a possibility, if the situation is not brought under control, that there could be further curbs during the weekdays also?
Well, definitely, Sneha, it is a possibility. From what we are understanding from our sources, Chief Minister Arvind Kejriwal, in his various meetings, he's been doing back-to-back meetings since 11 a.m. today. He did mention if the numbers do not come down, there is a possibility we could see an extension of this weekend lockdown. We are seeing how Maharashtra has been put under 15 days of curfew. Something similar can be expected, but it all depends on the numbers which come out on Monday morning. Chief Minister himself will review the situation, and only then will they take a further course of action. But yes, at the moment, no state government at the moment is shying away from saying they will impose lockdowns, because if you remember, Prime Minister Narendra Modi has also told the chief ministers they need to evaluate their own states. They need to see how numbers are rising, what all they can do, and then individually they will have to take a call depending on the situation in their state. Sneha.
That's right. Aishwarya, and I'm going to come back to this question because this just concerns so many people. Gyms, restaurants, malls are getting closed. What is the kind of help that the Delhi government intends to extend to people in terms of a financial package? Is that something that is being discussed right now? Because what we saw the last time around was that more than the infection, being out of job is what killed and distressed so many people, isn't it?
Well, if you talk about Delhi, so far we are not hearing any sort of financial aid being given by the Delhi government. But also, let us remember, at the moment, the only announcement being made is of a weekend lockdown. In case Arvind Kejriwal and the government, they decide to extend this lockdown, there is a possibility we could see them shelling out some money from their kitty to help those who need it the most. We are seeing how Maharashtra government has also doled out close to 5,000 crore rupees to help those who will be badly impacted by the lockdown. In Delhi, we are yet to see. But yes, it did come up in discussions, and everything now, Sneha, depends on the number of cases we see on Monday morning. Everything else will depend on the number of cases which we see in the national capital after the weekend lockdown.
That's right. Also, Aishwarya, I have a question regarding the kind of efforts that the Delhi government is now going to take to improve the infrastructure, given the fact that labs have come on record and said, look, we can't take any more samples anymore. There are just too many samples. We are not getting the results. We can't keep on piling samples. People are not being allowed to give their tests. Also, burden as far as the oxygen supply is concerned. How is the Delhi government going to ramp up all of this? The last time around we saw them rope in hospitals as per the guidelines of the center, rope in hotels, I beg your pardon, as per the guidelines of the center. Are these steps also now being looked at in terms of improving the healthcare infrastructure?
Well, definitely. We are seeing how in the past 2 days the Delhi government has been issuing a lot of orders. In fact, one of the major orders is attaching a lot of hospitals with 3-star, 4-star and 5-star hotels. In fact, the government has also capped the price. If you go and get yourself admitted in a 5-star hotel, it will cost you 5,000 rupees. If you go to a 4-star or a 3-star hotel, the price is being capped at 4,000 rupees per day. Now, there is an entire list which the government has come out with. They just want to increase the beds, which is why they are doing so. In fact, a couple of banquet halls have also been converted into beds. There are many beds in the national capital at the moment, which is why Arvind Kejriwal is so confident that Delhi's infrastructure will not crumble. He only believes it is now time for the people also to share the burden. People should not step out. They should not flout norms, and wearing a mask is a must. Arvind Kejriwal in his press conference very clearly said, we do get images, we do get videos of many people flouting norms and not wearing the mask, which according to him is one of the major reasons why we are seeing this spike, Neha.
That's right. Aishwarya, the other thing is that we keep talking about this, going back to basics, but I don't see it happening at all. And tell me if your experience is different. Where is the contact tracing that's happening in the national capital? We have over 6,000 containment zones. Are people getting tracked? Is there surveillance testing in the form of rapid antigen that is happening right now in Delhi to ensure that those people who've come in contact with positive patients are then tracked, are then sent for testing? Is that a reality in Delhi any longer?
Contact tracing definitely, Sneha, is a big thing in question, and those are the questions which have been asked of the Chief Minister also. A lot of people have been tagging him in their tweets and asking him why contact tracing is not happening. They are also saying, why did the Chief Minister wait until the number became 17,000 in 24 hours for him to take all these steps? So definitely questions are being raised at the moment. And one of the things which the Chief Ministers, and not just Delhi and Maharashtra, other Chief Ministers too of the states are now looking at doing is imposing some kind of a lockdown to make sure people do not step out. But yes, questions definitely are being raised of why contact tracing is not being done. If you remember, almost a year back, we were in a similar situation. Obviously, the numbers were not this high, but the governments were doing contact tracing. They were asking people not to meet. All those things went for a toss, because of which we are seeing the kind of numbers we are seeing. And here too, Sneha, where I'm standing at the vaccination center, barely people are coming to get themselves vaccinated. This is also a major cause of concern for leaders across the country.
All right, be with us, Aishwarya. Kumar Kunal, my colleague, is also getting us more details on that story. Kumar, what is it that you're seeing around you in terms of gross violation of norms, given the fact that the Delhi government has had to now take this step, announce a weekend curfew? The fear now is that there could be more restrictions in the weekdays also, and the balance always has to be maintained between lives and livelihood. And that, again, is a tightrope walk, isn't it, for the government?
Yes, the major challenge would be to implement all these orders which has been issued and even being described by Arvind Kejriwal just a few minutes ago in his press conference. So the most challenging task would be how they will implement it on ground. Because as we all know, that Delhi police is not under Delhi government, hence Delhi police will have to make a stricter guideline to make it implemented on the ground. And hence tomorrow there will be a crucial meeting taken by Delhi Lieutenant Governor. He will take the meeting. All the district magistrate, all the DCPs and senior officials from Delhi Police, all the 3 MCD commissioners will participate in that meeting, and then a strategy will be chalked out that how it will be implemented from Friday evening onwards, and a weekend curfew which will continue till Monday morning. And after that, even restriction on the weekdays, like malls will be closed, gyms will be closed, other things, other restrictions on weekly markets have also to be maintained. So all these things will be taken care of. But now, although the orders have come, but the main focus will be on implementation from here on.
Yes. Also, Kunal, and I was asking Aishwarya also about this, that there is a possibility that if this situation is not brought under control, right now we're seeing 17,000 cases, with Delhi being the worst hit city in the country right now. possibility of restrictions being extended to the weekday as well, and that's where the problem really comes in, because there would be people who would say that we barely recovered from last year and now this.
Of surge we have witnessed in last few days. The number have touched 17,282 now, and if the surge will continue in days to come, then stricter guidelines might have to be followed in process to contain the virus. And that's why even earlier Arvind Kejriwal has denied that they are not going to implement any kind of lockdown, but now Delhi government has come up with the idea of weekend lockdown and severe restrictions for the weekdays as well. So if they will unable to contain the virus in days to come, even after the weekend lockdown, then more serious guidelines can be issued from Delhi government, and that has to be taken in consideration, as even although Kejriwal and his government is claiming that there is no dearth of bed, there is no scarcity of beds are available, but up to a limit you can increase the number of beds. After that you have to work on the containment of the virus, and that is the most important part. And the implementation, what I am talking about earlier, that will be also quite important in view of the surge in numbers.
Yes, and I think that's going to be the next step really, given the fact that he said 5,000 beds are there in Delhi right now. But correct me if I'm wrong, the demand is just so much more. I think all of us know at least a handful of people in our circle who probably are patients and require hospitalization with oxygen beds, perhaps even ventilators, isn't it, Kumar? Tell us, is the Delhi government going to now make an attempt to improve, ramp up hospital capacity also, because 5,000 beds certainly isn't good enough, isn't it?
See, beds are available, but normal beds are more in numbers. If you will talk about ICU beds or ventilator beds, they are quite few in number. And that is what the main worry is, because people are looking for, and more serious patients who are going to hospital, they are looking for ICU beds or ventilator beds. And those beds are quite few in number, handful of in numbers. And that's why the concern around the beds, as you told that there are several people who are roaming around and they are not finding beds in several hospitals. They have to go visit several hospitals, and even they are unable to get. One more challenge is there for the availability of plasma as well. People are not getting plasma because doctors are recommending plasma therapy in some of the serious conditions, and there is a scarcity of plasma as well. So three main challenges are there. One is ICU bed, second is ventilator, and the third one is plasma. All these three should be worked on, and in the meeting between Delhi Chief Minister and the Delhi LG, all these issues has also been discussed. So medical bed availability is one thing. Those are more normal beds which is available for not that serious kind of patient. But once you are serious, you require ICU beds and ventilator beds. Those beds are very few in numbers, and that is the main problem what Delhiites are facing right now.
Oh yes, absolutely. These are beds that are available, but like you rightly pointed out, Kumar, there are beds that are required that need to be ventilator supported, that need to be oxygen supported. What about patients who then require oxygen therapy or require to be on a ventilator? Because usually if you do not require ventilators and you do not require oxygen therapy, then you can very well recover when you're isolated safely at home. We'll continue to talk about that big story in just a bit from now. I'm going to come back to you both, Kumar and Aishwarya, in a bit. For the moment, it's time for a quick break here. Much more news in just 2 minutes.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.